Walking 8,000 steps daily can lower the likelihood of untimely death. The University of Granada recently conducted a study on a global scale, which has determined the most advantageous quantity of steps for individuals to take. This is the first time such a number has been pinpointed. The results also indicate that the speed at which people walk can provide added benefits. The concept of taking 10,000 steps per day was first introduced in Japan during the 1960s, but it was not founded on scientific evidence. However, recent studies have indicated that focusing on the risk of mortality from cardiovascular disease, the majority of the advantages are observed with an approximate of 7,000 steps. The University of Granada, UGR, spearheaded an international investigation that offers scientific evidence for the number of steps needed to decrease the likelihood of untimely death. 8,000. This figure is equivalent to about 6.4 kilometers walked daily and is calculated based on the average length of a human stride, which is 76 centimeters for men and 67 centimeters for women. Studies have demonstrated that walking speed has added advantages, and that a faster pace is preferable to a slower one. The risk of fatality resulting from cardiovascular disease is particularly reduced after taking around 7,000 steps. This week, a study was published in the prominent cardiology publication, the Journal of the American College of Cardiology. It marks the first time that the most advantageous quantity of steps taken has been identified. Additionally, the study reveals that the speed at which one walks also contributes to increased benefits. Collaborative research was conducted between scholars from several countries. The Netherlands, represented by the Radboud University Medical Center, Spain, represented by the Universities of Granada and Castilla-La Mancha, and the United States, represented by Iowa State University. The lead author of the study, Francisco B. Ortega, who is a professor at the Department of Physical Education and Sports at UGR, explains that traditionally, people believed that achieving 10,000 steps per day was necessary to reap the benefits of physical activity. However, this idea originated from Japan in the 1960s and was not based on scientific evidence. The first pedometer marketed to the general public was even named the 10,000 steps meter, a direct translation, despite a lack of scientific backing. Ortega and his team have now provided the first evidence to support the notion that the more steps one takes, the better. They have also shown that there is no maximum number of steps that could be harmful to health. Ortega suggests that most people should aim for 7,000, 9,000 steps each day as a reasonable goal for optimal health. The team of researchers carried out a thorough analysis of literature and conducted a meta-analysis of findings from 12 international studies. These studies included over 110,000 participants. Recent studies have demonstrated that health benefits can be achieved by taking less than 10,000 steps, findings which are consistent with the results of this study. However, what sets this study apart is that it establishes specific step targets, a distinction that is emphasized by Esme Bakker, a Marie Curie postdoctoral research fellow at the University of Granada and one of the study's principal authors. According to the researchers, incremental gains in daily step count can provide significant health benefits. Even a slight increase in steps per day can lead to measurable improvements, particularly for individuals with low physical activity levels. The study found that adding just 500 steps to one's daily routine can lead to enhanced health outcomes. This is positive news, considering that not everyone can easily walk nearly 9,000 steps each day. Instead, setting small and achievable goals can help individuals improve their health gradually over time. The study found that there were no discernible disparities between genders. Furthermore, it discovered that walking at a quicker pace is linked to a lower chance of premature mortality, regardless of the total number of steps taken daily. Bakker also stated that the method used to count steps, whether it be a smartwatch, wrist-based activity tracker, or smartphone in your pocket, doesn't matter when it comes to achieving step goals. However, does this mean that we should stop walking once we've reached approximately 9,000 steps? Francisco B. Ortega disagrees, saying that more steps are never bad. Even as many as 16,000 steps a day does not pose any risk, and there are additional benefits compared to walking 7,000, 9,000 steps daily. However, the differences in risk reduction are minor. It's important to consider age when setting a step goal, with younger individuals able to set a higher target than older individuals. It is important to acknowledge that our examination solely focused on the impact of physical activity on the likelihood of contracting cardiovascular disease or experiencing all-cause mortality. Other studies and extensive scientific research have demonstrated that engaging in moderate or intense physical activity can yield numerous health advantages. These benefits include, but are not limited to, better mental health and quality of sleep. Bakker asserts that our research provides people with plain, measurable objectives. The International Physical Activity Guidelines suggest that adults should partake in 150, 300 minutes of exercise that is moderately intense per week. However, most individuals are unaware of what particular exercises qualify as moderate intensity, which makes it challenging for them to confirm that they are adhering to the exercise standard. Counting steps is significantly more straightforward, especially since smartphones and smartwatches are commonplace. This is where our research is important, to offer uncomplicated and explicit aims for the number of steps that individuals can effortlessly track using their mobile devices or wristbands and in turn promote better health, the authors conclude. To support our channel's growth and ensure broader awareness, kindly hit the like and subscribe buttons. This will help us reach more individuals and disseminate valuable information. Thank you in advance.